Okay, so I have already checked my patient's health history and ensured that I've obtained an order from the physician in order to insert an NG tube, as well as checked over all their allergies. I have gathered all my supplies that you see here on the bedside table, as well as already cut my strips on the side here that I will need to perform the NG tube insertion. I'm now going to enter the patient's room and address the patient. Hi Hector. My name is Jazzie. I'm a PNW nursing student and I'm going to be your nurse today, inserting an NG tube into you. First and foremost, do you mind if I check your ID band? Perfect. Can you state your full name and date of birth for me? Okay, Hector Guadalupe, 2/14/1969. Perfect. Happy belated birthday. Okay, so did the doctor already come and talk to you about your NG tube? Okay, yes. So basically we're going to be inserting a tube in through one of your nostrils, down the back of your throat and into your stomach, and that way we can still give you food and nutrients, but it's also going to help kind of suppress the vomiting and hopefully make you feel better, okay? Is that okay with you? Perfect. I've also already made sure I've obtained any physical signed consent forms as well as obtained verbal consent from our patient. So next, I'm just going to perform hand hygiene and play on my personal hygiene here. This is the most unfun part, I know. It's just for my safety and yours. Nothing too daunting. Anything to make sure my patient is okay. Alrighty. I'll be needing those today. Alright, so now I'm just going to don my gloves here. Okay. And now I'm going to take a drape and put this over my patient. Okay. And Hector, I have a emesis basin here for you in case you need to vomit. It's here for your use. Okay, I'll just put that right there for you. Okay, any allergies, Hector, to your knowledge? Okay, great. Awesome. I always want to make sure. Next, I will take out my NG tube. And I'm going to measure it from the tip of the patient's nose to their ear, and then from their ear down to their xiphoid process, which is directly underneath the sternum, which is where the stomach would be. Okay, I'm just going to very quickly mark this with a marker. And now I'm going to measure it. Okay. So it is about 58 centimeters. And according, I've already checked my company's guidelines, and it states to advance the tube 2 centimeters further once inserted. So I will advance it to a total of 60 centimeters. Okay. Next, I will getting ahead of myself here. Miss Hector, can you please clamp each side of your nose and take in a deep breath in and out for me and tell me which side you breathe better out of. Perfect, your right side. Okay, so that is where we will be inserting the NG tube, as it's just easier, okay? So if I can just have you lean your head back just a little bit for me. I would apply any topical anesthetic to the patient's nostril and pharynx if applicable, as well as taking some lubricant and lubricating the end of my tube here. Okay. Alright, and now holding it, I will just have you tilt your head back some for me, and I'm going to insert the tube at an upward and backward angle into the right nair. The patient will most likely gag, so I will make sure everything's okay. How you doing, Hector? You doing all right? Okay, and now that I've reached the pharynx, I'm going to stop, check on my patient. You doing okay? Awesome. So now I'm going to have you just tilt your head forward for me, chin to chest, and I'm going to have you drink some tea here, and then just take some sips. And I'm going to advance the tube every time he takes a sip, or he swallows. So. Okay. There may be some coughing and gagging. That is normal. If the patient were gasping or having difficulty speaking or showing signs of cyanosis, I would immediately terminate the procedure, remove the tube. If there is persistent coughing or gasping or gagging, I would take a tongue depressor and open the patient's mouth and check their oropharynx to ensure that the tube was not coiled. If it was, I would remove it and then try to reinsert. Okay, I think I'm in the right place. So now I'm going to advance the tube 2 centimeters more, and I'm going to loosely secure with tape. Okay, and then I'm going to just, I can confirm with 2 ways. I can either do an x-ray, or the way that I will be doing is just taking a syringe here and checking for gastric secretions. I'm looking for color consistency. Okay, yep, I have a nice brown coloration that is consistent with gastric secretions. I'm just going to advance this back into the tube. Through the tube and into the stomach. I'm going to remove my syringe. into scar. Next, I'm going to apply a skin barrier cream while keeping the tubing clamped. I'm going to apply a skin barrier cream to the top of their nair as well as inside to ensure there's no skin breakdown. I'm going to remove this tape and I'm going to secure the tube properly to the patient's nose here. Okay. Perfect. How you doing, Hector? You doing all right? Awesome. Okay, and that's an NG tube reception. Thank you.